what we know from animal models, that the vascularization changes, that NO is increasing, that the supply of blood is going up, that we have some growth factors that are increasing, that there might be some vibration sensitive channels that respond. But I think this is, at my opinion at the moment, very unspecific changes. So I compare it somehow with a patient who does aerobic exercise, who has also improvement in cognitive function, and also you can measure plasticity changes. For example, in Parkinson's, it's well investigated that bicycling leads to plasticity changes in the brain, also in MRI scans and so on. So we don't know whether it's a really specific effect or whether it's more increasing the whole metabolism, and thus as a secondary effect is increasing the performance in the patients. We don't really know that yet. And but if you have an old patient who is not very active in sports and who has that disease and is not a patient who is for the antibody treatment open, and which is still not approved in the EU, and also might have too much contraindications, too old, for example, then it might make sense to give it a try. Of course, it's also not clear where and how to stimulate directly. I mean, we stimulate in a low frequency stimulation manner, and it's not clear whether it would make sense to stimulate in other frequency if you would construct the idea that you have a direct neuromodulation effect. Then you could also argue to stimulate in different frequencies. We don't know that yet, whether we have a direct effect on oscillatory brain rhythms. If it's just a metabolic change, then maybe it's not that important. But these questions are also open. It's also open which networks directly to stimulate, whether it's better maybe to stimulate more temporal areas. It's also not clear how deep exactly the pulses get, whether it's possible to reach the hippocampus, for example, or whether we stay more superficial. So that's also not good investigated yet. So we are very at the beginning. We see positive effects. We see positive affective effects. Patients getting more active, less depressed, and patients come back for the treatment because they have the impression that that's changing their everyday life, at least for a course of some weeks.